Welcome back to Born for This Stories. I'm Dr. Johanna, a holistic doctor, mother, and someone who's walked the deeply personal road of pediatric surgery. And today, we are inviting you into a conversation that changed everything for us as a family. You are about to hear from Dr. Nicol Bush and Dr. Warren Snodgrass, two of the world's leading pediatric urologists who specialize in hypospadias repair. But this isn't just a medical interview. This is about hope, clarity, and reclaiming trust as a parent after a diagnosis that rocks your world. What you'll hear in this first part is the human side of surgical expertise, the why behind what they do, and how their practice became a lifeline for families like ours. So take a deep breath. Whether you're at the beginning of your journey or deep in the middle of it, you are not alone. Let's step into this story together. Yeah, so we're here with Dr. Nicol Bush and Dr. Warren Snodgrass. We're so excited to have you guys here. You guys are known in your field as pediatric urologists with even more specialty in helping with hypospadias repair. So we would love to get some information from each one of you on what brought you into this actual little niche that you're in and why you do it. Let's start with that.
Warren, why don't you start?
Yeah, well, when I was in training, I had a good mentor who kind of interested me in pediatric urology, and that included hypospadias surgery. And I enjoyed that and went out into practice wanting to do that. But I soon found that the results of the surgeries that I was doing were not what I thought. I hadn't seen the postoperative results in training. And when I saw them in private practice, they were not optimal. And so I didn't know what to do about that, but I knew I wasn't happy with it. I talked to other people at meetings and stuff and said, do you see this? What is there something I can do to make things better? And then an article came out in a journal talking about a little tweak that you could do that would improve exactly the concern that I had. So I went to the operating room to do that. And I didn't really understand how to do exactly that tweak that was described, and instead ended up making a different operation out of it that didn't work, and continued doing that and found that no, this way to correct hypospadias, this was for distal hypospadias, less severe hypospadias, that it worked, and that it worked consistently, and it made a normal appearance. That was the key. Was not just making something that worked, but making something that worked and looked natural. And that took off. I mean, that's done now all around the world.
Yeah, I think that's amazing.
Yeah, to piggyback off of that, one of the girls that's helping us with this podcast actually was a nanny for us after our son had surgery. And when we started this podcast, she goes, I had no idea that he even did that. And we're talking, she changed diapers and she had no idea.
Yep.
We had a patient that recently got admitted to the ICU with, I think, both the flu and COVID, and was very, very ill. And they had to put a catheter in, and the family kind of found out about it afterwards because their son was so sick that it happened. They were like, oh, wait, is everything okay with the catheter, with the hypospadias? They got kind of panicked. And the nurse putting the catheter in didn't even know that circumstance. I said, I think that's a pretty good sign that everything's
Good result.
looking like it's supposed to down there. And that was even in a multiple redo circumstance. So, that's a big part of how I ended up in hypospadias. I really loved the reconstructive aspect of it. I trained under him, and it was just so unbelievable to see these penises transformed into something that wasn't right, that then looked right. And I love the meticulousness of it and all the details of it. And then when I started my own practice, of course, that was something that I brought in, and that was where I really saw the impact that it was having on families. Mm-hmm. And I think that was something he didn't see as much because Children's, when we were at the university setting, he was seeing 50, 60, 70 patients in a day. That was just how it was. And there wasn't time to stop and understand these stories. And so we left for that university setting, started this practice with the whole goal of having a place where people could come for hypospadias care. And wow, I mean, we both thought we knew a lot when we started this practice 10 years ago.
We learned how little we knew.
Oh, yeah. It's always humbling.
Yeah.
That was a question that I did have, was the commonality of this and of the diagnosis itself. When we first got the diagnosis, I'm pretty sure our number that we heard the nurse say was, well, we see about 200 patient visits a week for this. And this is just one office near us. Does that sound accurate, or what are you guys seeing?
No, oh, that doesn't sound accurate at all. Well, there's kind of two things that go with that. First off, your experience of not really knowing what this was until your son had it is absolutely typical. Most moms and dads have never heard of it. Their parents have never heard of it. And so they're frightened when they're told their son has a birth defect that they've never heard of, and people start Googling, and that can lead down dark places. And so it's a really bad situation in that regard. And one of our goals at our Hypospadias Specialty Center is to work to increase public awareness to take care of that. The other important point to make is that once you get past that, and you finally see, like, your primary care doctor or a pediatric urologist, somebody is going to say to you, oh, this is a common birth defect, and give you the idea, like that nurse said to you, as though, well, we see this all the time. Mm-hmm. But the fact is that no birth defect is common. And so if you have a common, uncommon thing, it's still uncommon. Mm-hmm. So hypospadias affects 0.5% of newborn boys. 2 million boys are born in the United States every year. 10,000 have hypospadias. So it's not something that, and even a pediatric urologist doesn't see this on a regular, frequent basis. And that's why, as Dr. Bush said, we set up this practice to kind of emphasize hypospadias and to provide specialty care because it's a challenging problem.
So just to add to that a little bit, on the first point, I think many families are surprised that there are more boys born with hypospadias every day than there are boys born with Down syndrome. Mm-hmm. Most of us have, seen a kid with Down syndrome or seen it advertised, even if we don't know somebody personally. And so it's really kind of interesting to tweak that and think that there are at least that many out there with hypospadias. But because of the body part that it happens on, no one's talking about it. Yeah. So that's kind of one aspect of it. If you go to, a huge stadium, like, for instance, AT&T Stadium where the Cowboys play, where we are, you can walk into that stadium, kind of guesstimate the percentage of men in there and divide that by 200. And that's how many guys in that stadium have hypospadias at that time. So that's a really kind of interesting way of thinking about it. So that's the common part of it. But the uncommon part of it is that the average pediatric urologist, according to the American Board of Urology kind of subspecialty exams and what surgeons report to that for their case logs, the average pediatric urologist does about 1 distal hypospadias repair a month and about 2 proximal or more severe hypospadias repairs a year. It's really hard to get good at complex surgeries that have lots and lots of steps to them when you're only doing it once or twice a year, for instance. And even once a month, there are surgeons who can and do very well in that regard, but there are others that, when you look at, kind of reporting statistics, don't do very well with it. And so you see this huge variety. And that's where I think it's really tricky for parents to know what the best thing is for their son.
In fact, there's articles that have been published that if you're not doing at least 20 or more repairs a year, that your complication rate is much higher than those who do. So there's lots of data, not only just for hypospadias, but for other complex operations, that people who do them more, centers that do them more, have better results than those that do it occasionally. So that's yet another point. So it is common in the sense that there's a lot of people with it. It's uncommon when you say, well, what percentage of the total number of men is that? And then when you're looking at, well, how often do surgeons do it? Well, there's 750 or so pediatric urologists and 10,000 boys being operated on, and it works out to those numbers, about 12 a year, and for severe hypospadias, 2 a year.
Yeah. And so I do remember when we had our teleconsult with Dr. Bush, you shared some of that information with us. And that was huge for me as we were doing the research, because you guys do more than that, from my understanding. And
in a week.
Yes. And I was like, well, if I had to choose someone of the two versus, multiple with inside that week, like, of course, I'm going to go with the people with more experience, because no one talks about it because it's such like a private area, but also, like, of course, just like many other parents that you speak with, like, we just want the best for our son and we want him to be as normal as possible, but for multiple parts of that, like from like functioning normally and all of that as well, and not just like actually looking normal. And that was one thing we spoke about before we got on this call today, is that for me also, it felt better that you guys were your own specialty center versus us having to show up at the hospital to have a surgery and to do it that way. Just from a consumer perspective, it was just like, for whatever reason in my mind, I'm like, it's just safer. Like, it just seems like a better situation all around versus, again, like directly into the hospital. And that's how it has to go. So,
well, from our standpoint, I mean, we ended up here at this center because of that same thing. When we were working in the hospital settings, when we would walk in to start surgery, I mean, it would be some of the most complex hypospadias surgeries that anyone in the world was known to do. And we might have a nurse, a scrub nurse, or a tech in there with us who didn't have any idea what hypospadias was, much less the steps that needed to happen. And we do the same thing all day, every day, but we were finding ourselves having to do other people's jobs. Okay, now I need you to load this needle, this direction, this way. And that just distracts
Not ideal
from everything that needs to take place from the surgery standpoint. So we ultimately found ourselves in this capacity so that we could have more control of the circumstance, to have people that we work with every single day that I just hold out my hand. I don't even need to ask for what's going to go in it. They know what's going to go in it, so that I can be concentrating on all of the very tiny mechanics of putting that stitch in the very best place, so that when our babies go to sleep, that they're going to sleep with the same person that I trust, because that I've worked with that person day in and day out, multiple times every single day. And I know they can get that pain control right before we ever even start surgery, for instance, and that the babies are going to wake up not in pain, because that increases blood pressure and increases risk of bleeding and all. I mean, there are so many aspects of things that can go wrong. You want to try to control every single thing that you can, to help make those outcomes the best. And then that goes into the nursing care afterwards.
Yeah.
What instructions do you get? Are you getting different instructions from this nurse versus that nurse versus the doctor, et cetera? All that, I think, plays a role.
Yeah, for sure. And just from our experience, like, obviously you guys have a very like well-oiled machine. Like, the staff is very caring. The information that is provided and the care that goes into to you as the caregiver too back there with your child is just like top notch, because that's never a situation we would ever have thought that we would have found ourselves in. And to be in something that we don't understand, and then to be handed your child coming off of anesthesia, it is not a fun place to be. However, the staff was amazing. I mean, just like very caring and just there for you. And it helps ease the intensity of it.
And even knowing everybody else there has gone through something similar and has seen it, and you're not dealing with somebody next to you that is pregnant or something different out from something else.
Right.
They're together and knows what's going on.
Mm-hmm. Yeah. Cool. All right. So we'll go through some of these other talking points. I know we could probably be here all day, but we'll be respectful of your time. So I think we did touch about this a little bit, but I think it is important to talk about like what is the emotional state of the parents and the caregivers when they're coming in. And I think that could be talked about from like the teleconference like level, but also like that first moment that like we're actually in that surgical center, like we're waiting, our child's been fasting, like we don't know what's going to happen, like, and you guys are great because you come in and you talk to us and all of that stuff, but like typically what do you see and how do you work with that?
Well, that is an emotional day when your child comes for surgery, but we start that process much earlier when we do the telemedicine with families, because we decided that we weren't going to duplicate the experience that we had at the medical center, where we had 10 or 15-minute time slots for each patient. So we spend 45 minutes or an hour with the first consultation going through all the details, not only of the surgery, but of reassuring mom that she's not responsible for her son having hypospadias, or if they've had unsuccessful surgery, that it wasn't something they did that caused the complication to happen. We talk in detail about what exactly is hypospadias and what causes that curvature that they keep hearing the word Cordy and have no idea what that is. And so we go through to demystify it. And so when then what you're worried about mostly is just what anybody who has a loved one who's having surgery is naturally just concerned that things go well in the operating room. But as she said, we work with the same anesthesiologist every single day. We work with the same team of people every single day and have for years. And so there isn't any other place like that only does hypospadias, and we do it all day, every day. So though I think those factors help, you still can't take away the natural anxiety that parents have. And we tell people, that are coming from out of town, well, you can go back as early as 48 hours after surgery, but not before then, because you need a day. That your child will be fine, but you need a day to breathe deep and see that, well, that went actually okay, and he's doing good, and we've got this now.
Yeah. Yeah. And we were out of state travelers. We're from Florida. So every time we picked up and hauled out to Texas.
Yeah.
So yeah, we totally understand.
Yeah, but it worked, right? It worked.
Yeah. I mean, it was totally worth all of like the time investment and everything. Like we're in a position where we feel like there was nothing that was going to stand in the way of like the right treatment for our son. Like we were going to figure that out no matter what. And I know not all families are thinking inside of that realm. But when we were faced with the fact that we're going to have to travel to Texas 3 times in 18 months for a surgery that like we understood based on what you guys were telling us, but like ultimately, like we didn't really know like how our son was going to really do with it and like really what it was going to be like until we lived it. That first time was pretty intense. So each time after that gets a little bit easier because then you understand it a little bit more. And then you experienced this a lot too. Like we did it at just like the 6, 12, 18-month mark. So like those are big milestones for a lot of kids. So I remember the first one, our son started to army crawl the day before surgery. And I was like, this is not going to be good. Like he's going to be have surgery. And then he's going to be just like pulling his body across the floor. And he did. And he was fine. And like we were more phased than he was for the most part through all of the stuff. And then I think maybe the second one, he started walking right as this happened,
right before.
And I was just like, yeah. So it is also impressive that like with going through this type of repair that the kids for the most part are resilient. It's a lot on the caregivers, but the kids are just like, oh, okay.
That was part of our decision making too, though, that we decided because being from a holistic based family, we really wanted to not do anything, but we kind of felt like we had to for this. And we debated waiting longer, and then we read about that and we didn't want to do that. And we felt we could take the burden of the pain and the angst that we're going through mentally, and he wouldn't have that at this age. And
I think that's such a crucial, point, because there are people who have this thought of, well, maybe I should just let, Johnny decide when he's a teenager if he wants this thing fixed or not. Yeah. And to me, it's a little like, you don't take a kid with cleft lip and say, I think Johnny should just decide when he's a teenager if he wants his lip fixed or not. Right. And why do we treat the penis any differently than we do the lip on the one hand? And on the other hand, the emotional and physical healing that has to take place in much older children or teenagers or adult men is so much more difficult. It's all doable, and we do everything that we can to, work on pain control and work with their work schedules and sports schedules that happen. There's so many more things to take into consideration. And so I really appreciate y'all's thought about that we as caregivers want to take this burden on instead of having to burden my son with that at some later point in life. And then that doesn't even really take into account the physical aspects of like less collagen and elastin that you have as you get older. And we really need that skin to stretch as much as possible and heal as ideally as possible. So there's a lot to unpack in all of that. But, for us, it's all we think about all day, every day, and having patients at all different ages, from young, tiny infants to kind of toddler age, to school age, to teenagers, to adults in middle life, to even men in their 60s. Like, there are different aspects of surgical care and postoperative care involved in each of those steps. But I think that having that understanding has really changed our practice. It's allowed us to better counsel families about what to expect. If you don't do surgery, what are some of the implications? Because that's a decision too, just as much as it's a decision to go into surgery, a decision not to have reconstructive surgery has implications to that. So, I think that all of these are really important points, and we could speak for weeks, I'm sure, to, talk about all of these things that we've learned, but having, finding a surgeon that kind of has some understanding of those aspects, I think is really important.
For sure. So I know the next question I have is like, what is one thing you guys wish parents knew before the initial consultation? And I know we had touched on some of the points, but definitely added more is like that there's nothing that you did to cause this is, I think, a big one, because I do see and at least a lot online in the Facebook groups, like moms just shaming themselves endlessly. Like, how did I do this to my child? Because I think that's just a natural inside of us that it must have been us. And then also, I think that at some point, I definitely want to talk about in the instances of like obviously picking the right surgeon, but what happens when someone doesn't? Like, because I know you guys do also help people that have had not so great surgeries.
So I'll start with the kind of mom impact, and let's take something that we know increases the risk for penile birth defects, and that's progesterone. So prenatal progesterone is something that many parents get, like with in vitro fertilization. Moms who've maybe had miscarriages in the past are sometimes recommended to get prenatal progesterone, or not prenatal, but kind of first trimester progesterone to help with that placenta. So we know that's a little bit of an increased risk factor, but we also know that the vast majority of boys that we see with hypospadias didn't have moms that got progesterone. Many of the moms who got progesterone don't have boys who had hypospadias. So even with a known increased risk factor, there still clearly is not a direct relationship that happens there. And so, and you can substitute the word progesterone for all sorts of things. Did I drink too much coffee? Should I not have had that glass of wine? Or was I wrong in taking Tylenol that day? I had a horrible headache. I mean, you can substitute any of those terms in there. And at the end of the day, something that you did is almost certainly not any different than what all sorts of other, moms have done, not just now, but throughout history.
Right.
And And we know that, from somebody back in kind of Napoleon's time a few years ago, a couple hundred years ago, who went through and counted all the military recruits with hypospadias, that those numbers weren't terribly different back a couple hundred years ago as they are today. And I'm just going to guess that most parents aren't doing things much different than families were a few hundred years ago.
Well, except that the whole world was a different place, right? There wasn't pesticides and some of these chemicals and all that stuff that you read about when you inevitably Google what causes hypospadias. So the bottom line is the most important thing is who knows what causes hypospadias. But what we do know is that mom and dad didn't cause it. You didn't cause it. You couldn't have prevented it from happening. And so people who are beginning the journey with their son to deal with hypospadias don't need to begin carrying that extra burden of, I caused this, I feel guilty about it. And the same thing with parents who've had unsuccessful surgery. They feel guilty too, especially if they then decide to do more research and find out that maybe there was somebody better qualified than who they chose to do it. And it's the same thing. Well, your pediatrician said this doctor does a great job, and you met that doctor, and that doctor, you felt comfortable with them, and it all sounded good. So the fact that it didn't go well happens to all surgeons. No surgeon has 100% success. But then if you find out,
tell you that you should run.
Yeah, don't go to that surgeon.
Yeah.
And so the bottom line though is if you find out that it can be done better in another setting, then that's not a place to put guilt on yourself. That's something that has to do with surgeons and surgical professions and all, how come things like this can happen. Yeah. So it's just a matter of, we try to help people navigate all this, but not to add weight to it, not to add shame or guilt to it. Sometimes when a complication happens, the surgeon implies or states to mom, well, I told you not to let him do this, or I bet he was jumping, something. They come up with some excuse. And most complications happen because of mistakes that the surgeon makes, something that could have been done better and wasn't. And so that's not the parents. There's no way that a parent can know all of this and can really find out all the details and try to sift through when they're choosing somebody to help their son.
Yeah. Yeah.
What we just heard from Dr. Bush and Dr. Snodgrass about why they built their practice the way they did, how they've reimagined surgical care for families like ours. It's more than expertise. It's heart. It's experience that's been sharpened by thousands of families walking through fear and choosing hope. In part 2, we go even deeper. We'll explore the emotional toll this journey takes on parents, how to choose the right surgeon, and the future of their clinic, which, yes, includes how they're thinking about succession planning and spreading this model of care globally. So if you're feeling comforted, validated, or just more equipped, stay with us. Part 2 drops next. And trust me, you'll want to hear where this conversation goes.